Okay, Tyler, I'm gonna give you a rundown here of Jessica. So one of the first things we talked about is kind of listing out what's bothering her. And I know it's a long list, but we're kind of used to seeing that. And so through this long list, we want to be able to look at, okay, what can we conceivably address and help with? And so the big things that jump out to us are the facial pain, the headache, all that she put number ones on, and then the teeth grinding and in the morning headaches and the frequent tossing and turning at night. Those are all things that we can commonly help with, especially in patients with Ehlers-Danlos syndrome. So with Ehlers-Danlos syndrome, the ligaments of the jaw joint, the temporomandibular joint, are also known as the TMJ, can get strained and stretched. And so as we did our intake on Jessica, it showed that. So this graph, not to bore you with numbers, but this graph represents friction inside the jaw joint. If you look at the left there, 23, that number right here, so that tells us that the disc inside the jaw joint is clicking, popping out of place. And Jessica was aware of that, but really didn't know the consequences of it necessarily. So that's quite significant. And we know that she's had a couple different grinding guards from dentists over the years to combat the clenching and grinding forces. So her teeth are, relatively in good shape, but we know there's excessive clenching forces. Now, the two most common causes of clenching and grinding are number one, nasal obstruction, and number two, pain, both of which she has. So as we asked her about her nose, she reported that her nose score, which is her perception of how stuffy it is severe. So that tells us that the nasal passages are severely congested, and it makes it difficult for her to breathe at nighttime. So as we look at her sleep study here, the results show what's called an RI, right here, respiratory index, of 4.3. So she used to have apnea before she had the gastric sleeve procedure, and now if that number was a 5, it'd be apnea, but it's a 4.3. So while you can technically not call it apnea, we can definitely call it 4 times an hour she's being woken up due to a breathing or suffocation event, and that would certainly lead to fatigue, not feeling well in the morning, and having difficulty staying soundly asleep. So that's quite significant. So as we look at her imaging that we took, this is her nose. So the tip of the nose is collapsed, and that's where like a breathe right strip will help. And Jessica will show you I can show you Jessica, as we do this, it helps tremendously improve her ability to breathe at night. So we're going to send her home with some tools to help with her breathing. The other significant thing we see in the nose is right here. This is called a concha bullosa. It's an air cell. So it's basically a collection of air that's entrapped inside the nose that impacts her ability to breathe functionally. So we'll start with the nasal spray and the nasal device just to help open the nose and see, okay, do we need to go see an ear, nose, and throat specialist for that or not? And I know she's already been to one, but we would have them look specifically at that, because in her sinus CT, they really didn't comment on that. And so it's not a tumor, it's not cancer or anything, but it's abnormal. And then here we look at her airway, and we know that the nose is a little blocked, and so the back of the throat is very narrow too. Red is the bottom of the scale here. So she's at 118, and 100 is the bottom right here. So we know that when she falls asleep at night, that jaw and tongue have the ability to collapse back, and that's kind of what she's experiencing when she lays on her side at nighttime. And more about that in a second. So as we look here at her jaw joints, so this is all the right side, and this is the left side. And you can appreciate as I zoom in here, so right here, this bone's nice and healthy and round. Over here, we're seeing a little irritation of what's called the cortical bone, and that's the side that the disc is popping in and out of place of. So the disc is supposed to be a shock absorber between the two bones, and the disc here is popping in and out of place. So that's in essence part of what we're treating. So in Jessica's case, what we want to do is we're going to treat this jaw joint dysfunction, this clenching and grinding, these headache pains, like a stress fracture. So if we have a bum ankle, we will put the ankle in a boot to protect it and allow it to heal. So in Jessica's case, we're going to use an orthotic like this that she'll wear during the day. It'll go on her bottom jaw. She'll eat with it, speak with it, and wear it all day long. It's pretty inconspicuous, but it's built up on the back here. There's a platform that allows her to function on and protect that jaw joint and quiet down the muscular pain and the headache pain. We did a series of exercises on her that we kind of illustrated to her that it'll help improve her balance and stability because of that jaw joint dysfunction. Now at nighttime, she'll wear an appliance like this white one. It'll go on her upper and lower jaw, and those rubber bands prevent that lower jaw from sagging backwards. So as I push that lower jaw back with my thumb, that band prevents the jaw from sagging back, and that band is interchangeable so that I can tighten it or loosen it. So it'll allow her to move still, but it won't allow the jaw to be overlaxed, which is precisely the problem with Ehlers-Danlos syndrome. So why does the jaw joint create so many issues with facial pain and stuff like that? This is called the homunculus. It's a 3D representation of the brain's devotion to our body. And as you can see here, the cortical brain has a lot of devotion to the face. And that's where we eat, breathe, sleep, see, and tactile sense of hands, how we hunt and gather food. So the brain devotes a whole lot of energy to the face and jaw joint structures because it's needed for survival. So that's why facial pain can be so debilitating and challenging, and that's why facial pain can really wreak havoc in patients' lives. So for Jessica's situation is we're not going to fix everything outright, and we don't intend to, but our goal is to eliminate and reduce as many of these symptoms as it relates to her jaw joint as we can, and get her feeling more refreshed in the morning. So by improving her breathing at night, by controlling the jaw joint dysfunction, our goal is to improve that quality of sleep, which will then improve her ability to heal, rest, and recover from the day's activity. And then there's also a physician up in Battle Creek we're going to send her to. Her salivary pH tested really low, really acidic, and with the strict need for the dietary changes with Ehlers-Danlos syndrome, we think it'd be good for her to meet with a kind of a doctor who that's their niche. And so we have a good group we've worked with up in Battle Creek that I think would be a good place to start. So we'll send her up there as we get started with the orthotics and get her comfortable over the next 12 weeks. And our goal is to follow through the care, make sure she's improved, and kind of be her advocate and cheer behind her the whole way. Okay. Anything else? I can always answer more questions, but I didn't want to bore you. So it was a quick 8 minutes.